Does Meghan Markle have Ozempic face? A patient of mine who had recently lost a significant amount of weight, naturally, I hasten to add, once asked me, "What is Ozempic face and do I have it?" I had no idea what Ozempic face was. And besides, he had not even taken Ozempic, at least I had not prescribed it to him. So my immediate thought was to say to him, "Well, you've not been taking this drug, what do you care?" He explained that no one believed he could lose the amount of weight he had, and we're talking around 60 pounds. People were accusing him of taking Ozempic, and someone had remarked that he had Ozempic face. So with that, I had a challenge: research Ozempic face and get back to him. In the meantime, I also got caught up with mainstream gossip media. Miss Markle, the Duchess of Sussex, was sporting a new slim look. The term Ozempic face was popping up all over the place about her. I now knew where my patient was getting his accusations from. So here is what I know about this whole Ozempic story, and I share that with you gladly. I get my story from, the source itself. One of my upcoming videos will be on a day in the life of a GP family doctor. It's not as boring as you think it might be, I promise. One of the tasks of a doctor, a GP, or a specialist in any field is, of course, continued medical education. To keep your license to practice, you have to do further training in your specialty. This, of course, is expected of many other professions, not just medicine. One way to achieve this continued medical education is to forge a cordial relationship, shall we say, with Big Pharma. Representatives of pharmaceutical companies have an interest, of course, to fund or at least support the continued education of doctors in order to pitch their wares, so to speak, to those who prescribe them. It's a symbiotic relationship because we doctors who have no direct contact with the movers and shakers in research, but who do have direct contact with the patients, of course, need to hear about the latest research, the latest drugs, the latest treatment on the market. So we get drug companies to pay us a visit now and again to give us mini presentations on the latest in pharmaceutical education. This is all very innocent. I had one such visit the other week from the makers of Ozempic, Danish pharmaceutical company Novo Nordisk. I had a visit from not only the pharma rep, but also from the sub-regional medical director, no less. By the way, I am in no way sponsored by or linked to any pharmaceutical company, just so you know. On that visit, recently, we talked about the indications and the use of Ozempic. Now, what impressed me about this conversation was that the medical director stated that, in fact, before the use of any medication in the Ozempic range, and I shall go through this in a minute, they do advocate in Novo Nordisk that first and foremost, the patient engages in lifestyle changes. Watch your diet, exercise, hydrate your body, etc. That surprised me. The pharma industry has such a bad rep, seemingly pushing drugs up all our noses. And yet, here was a pharma industry bigwig telling me the common sense truth of how these weight-reducing drugs should be used. Basically as a fail-safety mechanism and not a first choice go-to for weight loss. I was actually touched by that. So let's talk about Ozempic and its indications. Here is the boring scientific part. Ozempic, scientific name semaglutide, belongs to a group of anti-diabetic medications known as glucagon-like peptide 1 agonists, GLP-1 for short. These drugs mimic the effect of certain intestinal hormones known as incretins involved in the control of blood sugar. A useful side effect of these drugs is that they suppress appetite by slowing digestion and tricking the brain into believing that the stomach is full. This rather fortuitous side effect led to the whole weight loss injectables industry. Semaglutide comes in many injectable forms, but one is oral in tablet form, and that's known as Rybelsus. More about Rybelsus later. Specifically, I can discuss the indications for semaglutide as approved for use in Switzerland, but I imagine it's the same or similar in other countries around the world. Ozempic and Rybelsus are actually only indicated for type 2 diabetes, as you can see in this chart here. Sorry, I only have it in German. The higher dose preparation, Wegovy, is the only one that is licensed for weight reduction. And to qualify for it, you have to have either obesity, body mass index over 30, or overweight or excess weight from body mass index 27 to 30, but with a complication of being overweight. For example, arthritis or back pain or diabetes or hypertension, etc. However, Ozempic and another GLP-1 agonist, liraglutide, trade name, at least in Switzerland, being Saxenda, have been used for years as weight loss injections. Novo Nordisk's guidelines for the correct treatment of diabetes is shown here. And in this official flyer, look at the prerequisites set above, indicated by the arrow. My medical director friend was not kidding. So what exactly is Ozempic Face? When a person loses weight, one of the first places this is evident is actually in the face. Those with round faces suddenly start to display an oblong-looking face. The jaw muscles start to look more defined, ripped even. The cheekbones start to show a clearer definition. The nose, whatever your race, gets narrower. Your eyes, on the other hand, get slightly larger. Meghan Markle has appeared rather svelte in the last few months, one can declare. She was never fat, of course, although she does have a bit of an odd body shape, which makes it hard to look ultra slim. But she's always been slim, nevertheless. I am not at all a body shamer, please don't get me wrong. I just noticed her waist to hip ratio is somewhat greater than the ideal 0.7, which normally gives women the typical and classical hourglass figure. She doesn't really have this. Her slightly higher waist to hip ratio makes her look a little bit more square in the middle, slightly masculine appearance, but not too much. It's almost like she has the appearance of a teenage boy in some of her fashion choices, shall we say. There are ways to overcome this body shape, but she doesn't really take advantage of this trick, I notice. But anyway, of course, it's a personal choice, and it's not relevant here. I am just commenting on her body shape as related to obesity in general. By the way, I have her type of body shape, so I do sympathize. The problem with this body shape is no matter how slim you are, you never quite get to look waif-like, if that's your thing. So yeah, it's frustrating. I do sympathize. Anyway, to get back to our topic, we see here that her face has lost much of the youthful glow it once had, despite the fact that she appears thinner. The key feature here is that the appearance is somewhat sudden. Therefore, this weight loss is a bit rapid, we can deduce, because not long before she looked like this. Already based on the timelines, we can ask ourselves, is this so rapid weight loss possible? Well, sure, it's possible, but then at what cost? Notice the lines, the little wrinkles. Again, I'm not body shaming, I'm just reporting on the photo shown here. This denotes a sudden loss of healthy fat cells within the subcutaneous tissue of the face. It is not really desirable to lose these fat cells because there needs to be a minimal layer of these fat cells to allow the face to retain its elasticity, its youthfulness. Extreme weight loss is sadly not attractive exactly because of this, because without this fatty layer, the skin tends to look aged and ragged. So if the point of the weight loss was to look younger, more attractive, this defeats the purpose if it's done too rapidly, and that's a shame. It also looks like there is a bit of what I would call Ozempic hair going on as well. Of course, there could be a concomitant iron deficiency or a thyroid problem or a trace element deficiency, notably zinc. I don't know. But what I see in this picture is what I describe. So to summarize, Ozempic face occurs when the drug causes a fast loss of subcutaneous fat in the face, resulting in a face that is older, perhaps even wan or tired looking. It is hard to achieve this look unless some sort of medical intervention was involved somehow. And this could be a stomach bypass operation, a jaw operation after a fracture of the jawbone, or chemotherapy. These are the kinds of interventions that allow for a rapid weight loss, resulting in this kind of facial appearance. Of course, if we're talking about natural phenomena, a big famine, a war, these can all also result in rapid weight loss where populations of people suddenly have no resources, including food. And I can imagine that there are many episodes in history where this kind of facial appearance would have been quite common. What can one do to reverse this kind of process in our modern world where Ozempic face is actually caused by the drug Ozempic? One way is to simply rehydrate the body, drinking lots of water, something like 3 liters a day, to plump up the cells of the skin everywhere in the body, but particularly in the face. Another common sense way is simply to reduce the drug or to stop it altogether, of course. Or how about attempting to lose weight in a more natural manner, which naturally slows down the process and avoids this kind of side effect where there is a rapid loss of subcutaneous tissue. There are, of course, other side effects of Ozempic, and so far we have the following: nausea, constipation, dizziness, fatigue, diarrhea, stomach pains, allergic reaction, hypoglycemia, low blood sugar, and blurred vision. The list is likely to get longer as users report more with the passage of time. Just to update you, my patient certainly did not have Ozempic face. He just had the normal facial appearance of someone who had lost a significant amount of weight and now simply looked better and healthier. So I think whoever told him he had Ozempic face was only trying to shame him. Perhaps there was an ulterior motive involved. Perhaps that person was not too happy that he had successfully lost weight in a natural fashion. I don't know. My conclusion on Meghan Markle would be that yes, the facial appearance we see in that photo would be consistent with Ozempic use, perhaps even overuse. Thank you for your attention. Whatever you do, stay healthy. And if in doubt about a health issue bugging you, don't hesitate to ask a doc.